Welcome to another episode of JPHMP Direct Talk, a podcast series that brings you conversations that bridge the gap between public health research and practice. Today we are joined by Dr. Paul Erwin, Dean of the School of Public Health at the University of Alabama at Birmingham, and long-standing member of the Journal of Public Health Management and Practice Editorial Board. Hi, Dr. Erwin. Thank you so much for joining me today. It's a pleasure to speak with you.
Give us a little overview of how you got into public health and how, the milestones along the way.
I do have to start where I started, which was growing up in a rural area in North Alabama, the son of last of the old country doctors who carried a black bag and made house calls, and I thought that's what I wanted to do with my life. But by the time I actually got to medical school and made it to my clinical years in the third and fourth years, I began to see that was not a viable possibility for me, that private practice of medicine had become a business and just did not seem to me to be either viable or very inspiring. So one conversation led to another, and I eventually ended up spending most of my last semester of medical school on a Hopkins-sponsored medical expedition in Nepal, and that's where my life's path changed, and where I became exposed to the whole notion of public health, the health of populations, and the factors that really influence whether or not a community has the capacity to be healthy. So the things that, fast forwarding to today, we know as social determinants of health, such as education, income, employment, and housing, all of those things became very apparent to me in Nepal as factors that had a strong influence on community health. And so part of the pathway was at that time also developing a relationship with the person who was to become a lifelong mentor for me, Dr. Jack Bryant, who someone renowned in the field of international health. And one of the things that Jack did was to convince me to complete my clinical training in medicine, because he thought that it was an important foundation for me to have. But then if I wanted to do something in the public health arena, that it would be important for me to get a master's in public health. So completed the residency in internal medicine and then did an MPH focusing on international health at Hopkins. And it was during that year that then I looped back to my mentor, Dr. Bryant, who at that time was at the Aga Khan University in Karachi, Pakistan. And I ended up doing an international fellowship with him for 2 years. Karachi, this was in the late 80s. My particular role was in helping to develop the junior faculty of our Department of Community Health Sciences to help teach Pakistani medical and nursing students in the field setting. Our classroom for our department were the squatter settlements of Karachi, where we tried to develop primary health care in the international health sense, sites for the governmental health services to be able to adopt. After doing that for 2 years, it was time for my family and I to come back to the United States. I thought it would be interesting to be on the governmental health services side of the equation from what we had been doing in Pakistan. So I ended up taking a job with the Tennessee Department of Health. And for most of a period of 16 years, I was a regional director for a region of 15 county health departments in mostly rural Appalachia, where I really learned public health. I found the same cycles of illness and absence of capacity for good health, lack of education and poverty and low employment that I saw in Nepal. And so those were the major issues that we had in front of us in the time that I was with the Tennessee Department of Health. During that time, I was also connected as an adjunct to the accredited public health program at the University of Tennessee. And as my career evolved, I thought at one point I would take a slightly different turn on my career path and move from practice to academia, and thought it would be important to complete a doctorate in public health, to go through the dissertation process myself. And as I was doing that through an executive program at UNC Chapel Hill, I had an opportunity to move into a position at the University of Tennessee in Knoxville. My work there at the University of Tennessee was to build out the accredited program, and so during my time there established a full-fledged Department of Public Health, and spent 11 years there. Then just this year, the opportunity to return to UAB was in front of me, and one thing led to another, and here I am.
What a wonderful career journey you've had. Can you talk a little about your new role at UAB and some of the goals or some of the projects you hope to work on while you're there, how you plan to facilitate some of the things that you have, some of the goals you have?
My goals are to have shared goals with the people who have been here for a long time. That's part of my learning process. Part of what we're going through now is a strategic planning process where we'll be able to clearly identify those goals. I can say what things that I have a particular interest in and have wanted to explore as an area of emphasis in my time here already. One is collaborative work and the mutually beneficial connections between public health practice and academia. It's something that I focused on when I was in public health practice. It's something that I devoted a considerable amount of time and energy and became an area of scholarly work for me when I was at the University of Tennessee. And it's something that I want to continue here. I know that there already here at the school is a strong connection between our School of Public Health and the local Jefferson County Department of Health, as well as the Alabama Department of Health. And my interest is in strengthening those connections in ways that, again, are mutually beneficial for the practice, for the workforce, beneficial for our faculty, and beneficial for students, and then ultimately beneficial to the communities that we all serve. So that's one area that I have a particular interest in. Another that I have been, again, just beginning to have conversations here about is a focus on the human health impact of climate change. This is an area that, at least as an institution, UAB does not have a particular focus on. There are certainly faculty across campus who are working in this arena, and some internationally renowned experts in that. And so I've been trying to understand and learn about the potential for us to build a focus on looking at the human health impact of climate change. It is already and will continue to impact us in ways that touches on every discipline within our School of Public Health. So that is an area of interest. And then I guess circling back to the notion of the connections between practice and academia, through that I bring a strong sense of the institution's obligations to the communities which we're located, the obligation that we have to serve our community, to bring our expertise to bear on the challenges and issues and problems that our communities face, and I want this school to be fully engaged in that. Of course, all the while recognizing that this is a research-intensive university, both a university and a school here at the School of Public Health that are highly regarded for their research productivity. And so I understand the importance of not just maintaining that, but growing that and expanding our reach and impact. And then when you throw in an element that many schools of public health are now experiencing, and that's the rapid growth in the undergraduate public health programs, there are many things to balance. It is definitely a challenge, but we have incredibly capable people here, our faculty, our staff, our students, and I feel that we are fully up to the challenge.
Can you speak to the importance of academic practice linkages as they relate to demographic shifts that will be creating a gap in the workforce as so many in public health begin to retire and others are left to kind of fill that gap?
It is an interesting place where we are, and at the same time a curiosity. Many of the readers, both practitioners and academicians of the Journal of Public Health Management and Practice, can personally vouch for the practice of public health, particularly when we think of governmental public health, either at the local, state, or federal level. And the academic disciplines within public health have been in many ways disconnected for decades. As one of my other mentors, Bill Keck, Dr. Bill Keck, has often described this, we couldn't imagine a medical school or a nursing school without a teaching hospital. Mm-hmm. In fact, when a medical or nursing student is in those clinical years, there's rarely the recognition that these are actually separate entities. There's the medical school, there's the hospital. Mm-hmm. We see them as integrated as one. I certainly never really recognized a distinction when I was in medical school. If that is the case in the model for health professions education, why have we not considered that important for public health? And so you think of the health department as the sort of the equivalent of the teaching hospital in that regard. And that's where this label, the academic health department, comes from. The formalized relationship between the academy and the practice site in a way that provides students with opportunities to apply classroom theory to real-world problems. It provides faculty with opportunities to have practice-informed teaching. Does our curriculum provide the kind of education that results in having students who are competent to work in the practice setting? Do we really teach to what the workforce actually needs? Is the research that we're doing relevant to the needs of practice? Does it answer their research questions? And at the same time, health departments are known for their ability to collect data and for their requirements to collect data, surveillance data of all sorts. How can faculty, public health faculty, work with practitioners to both understand and analyze those data so that those data become the evidence base for what public health practice then becomes? So all of those elements together, I think, are critical for thinking about the workforce and how we prepare the future workforce.
Would you like to talk a little about MAPP?
I had the good fortune of being on the NACHO, the original NACHO work group that developed MAPP, and eventually chaired that work group as well. I think all of us who were involved in the development of MAPP saw the huge potential for MAPP to be a point of connectivity, a place of connectivity between practice and academia. And I think that in my experience, it certainly has played out that way. It played out that way when I was in practice, where as a part of doing one of the 4 MAPP assessments, the Local Public Health Systems Assessment, we actually partnered with the University of Tennessee MPH program, who had a course in community health assessment. And so doing the Local Public Health System Assessment in the field became the work of the course. We actually wrote that up in a couple of articles published in the journal back in the mid-2000s, early to mid-2000s. The most recent series of case studies that Dr. Novick put together in a wonderful little book is also an example of our academic practice linkages. The one that we did describing the University of Tennessee's collaboration with the Knox County Health Department in conducting 2 iterations of MAPP. And it's actually what I'm seeing here, and I was wonderfully surprised at seeing one of the first discussions that I had with the Jefferson County Health Department folks here was a contract between the health department and the school for us to assist their work in those 4 MAPP assessments. I think MAPP provides a great platform for practice academic linkages that really do maximize the expertise of each of those players. And again, ultimately, for the benefit of the community, because I think it does result in very comprehensive, evidence-based strategic plan that provides the springboard for action.
You've mentioned a couple of your mentors. Can you describe the way that students go about finding their mentors and the importance of that, the importance of mentors on the long-term career of public health professionals?
Yeah, it is so important, and I've been so very fortunate in having really great mentors. I mentioned 2 of them, as you noted, Dr. Bryan and Dr. Bill Keck. Dr. Doug Scutchfield is another one. What I tell students, there's so much information available on faculty websites, on the faculty pages on the university website, whether I was at Tennessee or now that I'm here in Birmingham. And so I tell students, look, go poke around those websites. Read what faculty are doing. And if you find something that really gets you going, gets your passion stirred, reach out to that faculty person. Be intentional about setting up time with that faculty person to meet with them and talk with them. I can understand often students' reluctance to take that step. It takes some degree of initiative and some degree of courage to do that, but I think it's so important because, at least in my experience at Tennessee and now here, faculty welcome that contact. Faculty actually thrive on that kind of initiative on the part of students, and it's often an entryway for students to become engaged in that faculty person's scholarly work. That's one way to do it. Another way is, if there's a course that you're taking, say to students that really does juices going, gets your passion up, let that faculty person know, and try to look for opportunities to stay connected with that faculty. Even even if it means volunteering time to assist that faculty person on any aspect of her or his work, whether it's other courses that faculty person is teaching or service or certainly scholarly work. But it takes intent, it takes some degree of courage and stepping out to reach out to faculty. But again, my experience, faculty welcome that. As I say to students, as you identify that mentor, nurture that relationship. Stay connected. If you leave the institution, if you graduate and you move on, stay connected. My staying connected with Dr. Bryant went from first meeting him in 1983 to working for him in Karachi in 1988 to working with him on projects in the field in Kenya as late as 2012 and 13. Spanned a lot of years. And he remained a mentor up until the time he passed at age 95, just last year, 2 years ago, sorry. And the same has held true with Bill Keck and Scutch. Nurture that relationship, and it becomes mutually fruitful. Bill Keck has, because of that mentorship, has provided me opportunities to be in Cuba several times, something that I wouldn't have had I not connected with Bill. And Scutch opened up so many opportunities for me in the areas of public health systems and services research that had I not, and had he not, made efforts to really nurture that relationship, those opportunities would not have come about.
Are there formal ways that mentorships are kind of cultivated in public health school programs?
It's often a one-to-one relationship, a student who reaches out to a faculty person. I won't say it's always that direction. Certainly there are many instances where faculty will identify someone who is written an inspiring, compelling paper for a course, and then reached out to that student to say, and I'd like to involve you in this piece of work that I'm doing, and this piece of research that I'm doing because of how you wrote about this. So there are those instances.
What kind of advice do you give students in terms of things like internships or fellowships, or are those the kinds of things that a relationship may develop as students inquire about those kinds of things with their faculty? Is maybe that one way that such a mentorship might develop?
Absolutely. Certainly, within the MPH degree program where the internship is the required field placement, that's a real opportunity for students to not only develop and establish a mentoring relationship, but it often becomes an opportunity for future employment because of that experience and that mentorship. So I strongly encourage students to be very, very intentional about that field placement, to see it as a really a golden opportunity because it's required as a part of their degree program, and so use it as an opportunity. Since you have to do it, use it as an opportunity for building your path to a career, to a lifelong mentorship relationship.
Camilla Singletary here has a nice little podcast where she talks with MPH students and new professionals who've just gotten their MPH and are out in the field. And some of the things that I am learning from listening to her podcast series is there's so many avenues. Public health is very diverse. And when they see others kind of doing something that they weren't even aware of, it seems to sometimes inspire them. And that's one of the things I think we try to do on Direct, is to sort of show portraits of lots of ways that people are involved in public health. And so I wondered also if, in terms of linking practice with academia, do you advise students to sort of dip their toes into lots of different things? Internships and fellowships are opportunities to explore. And as you said, you kind of found your calling because of your fellowship. The more experiences they have out there. So Do you sort of recommend to students to try, a little practice so that they can sort of build some type of foundation, or to move between areas until they find the perfect fit?
I like the way you put that, move between areas until you find a fit, because students might think they know what their path looks like when they start a program, but be open, be open-minded. I thought I wanted to be a country doctor and carry my own black bag, but I was open to other possibilities, and being open to those possibilities really provided me with opportunities. And so there's nothing wrong with experimenting. There's nothing wrong with students dabbling here and dabbling there to see what ultimately for them becomes the right fit. So I strongly encourage that.
This year is the 25th anniversary of the Journal of Public Health Management and Practice. I wonder if you could speak to some of the crowning achievements of the journal in that time.
Certainly. And I would add to all of my list of mentors Dr. Novick, because for whatever reason, in his wisdom and insight, he saw something in my early writing and my early attempts to produce scholarly paper or two for the journal that, although I was certainly rough and around the edges in many ways and needed guidance, there was something he saw there that propelled him to invest time, and that really produced confidence in me and confidence in him. So I think the journal has been the place that has allowed public health professionals who don't come into the scholarly work from a purely academic position to tell their story. Not everything that's important has a p-value attached to it. And although there certainly is quite a bit of good quantitative focused scholarly work that gets published in the journal, what I have been particularly impressed by over the years is, again, an opportunity for practitioners or people who are in the early stages of an academic career be able to have a venue, a platform for telling a story well in a way that creates a substantive article that isn't just a personal memento, but is scholarly work that's more qualitatively oriented. I think that's been one of the greatest contributions of the journal. It's also, in that sense, has been a place that has created a community of practice-focused scholars and scholarly-focused practitioners. And I know of no other journal that really does that kind of embracing. There are colleagues you get to know through the journal because of either who's on the editorial board, who's submitting publications, whose articles appear in the journal, who become guest editors. It is a community of, I think, like-minded people who see this critically important connection between practice and academia in a way that I don't think any other journal does.
Thank you very much for saying that. Okay, now tell me about your poetry.
Oh, goodness. I actually took a year off after my internship in medicine during my residency. So after my first year, I took a year off and returned to my college alma mater, Sewanee, which is a long connection and history of good writing. I wanted to go and try and hone that craft. And so that's what I did for that year. And although my writing of poetry has tailed off over the years, what I learned and what I have been able to keep is an appreciation for words and expression and the craft of writing. So while I'm not writing much in the way of poetry in the strict sense of the word now, I try to channel that same creative energy into what I hope is good editing and some of my journal responsibilities, and what I want to continue to be as thoughtful writing that invites people to read.
Well, this has really been a terrific conversation, Dr. Erwin. Thank you so much for your time.